get answered for yourself. All right, we have now we have the program today. Um, we have Dorothea C. Lerman from the U of H Clear Lake Autism Center. Um, Dorothea is professor of Behavioral Analysis Center, our chair, Behavior Analysis Program Director, Center for Autism and Development Disabilities, Department of Clinical Health, and also Applied Sciences, University of Houston Clear Lake. Let's all welcome Dorothea Lerman as our speaker. Thank you, Dorothy. Could you please lead the the speech for us today?
Yes, thank you very much. I assume everyone can hear me okay and can see the screen okay? Okay,
Yes, you have your
wonderful.
screen up. Yes.
Well, I always look forward every year to visiting with your group and telling you about our most recent developments and programs and what we're up to, and have always really much appreciated the support of your group. And with everything going on, I didn't know that your group was still meeting. And so when I found out, I was just so delighted that I was still able to meet with you and give you an update. And I think that I'm particularly excited because the graduate students, the faculty, and the staff at our center have really stepped up to the plate and have done some amazing things since COVID, help the families in our community. And so I'm going to start and just tell you what we were doing before COVID and now telling you what we've been doing since COVID. It's something that I'm just so excited about and really proud of. Here are our programs. We have programs both on and off campus. And so before COVID, I want to tell you about each of our programs. So our Severe Behavior Disorders Research Clinic, with seeing clients and families at our on-campus center at the University of Houston Clear Lake. They serve individuals with any developmental disability, any age, who engage in some type of severe behavior disorder, such as aggression, self-injury, disruption, property. And they do assessments and intervention evaluations and caregiver training. Our OpposKit program, state-funded program that we are doing through a subcontract with the Harris Center, we've been doing for a number of years, where we provide services to children with a diagnosis of autism in the ages of 3 and 15, and they can have up to 30 hours of intervention services a month. And we do that in addition to some caregiver training. Our Verbal Behavior Clinic serves individuals with any developmental disability, any age, with a focus on language and social skills that also emphasizes caregiver training. Several years ago, the Verbal Behavior Clinic and the Severe Behavior Disorders Research Clinic partnered to develop our Connecting the Dots program, which is a 12-week training program that's funded by a grant through the Texas Higher Education Coordinating Board. And we found out just last month, actually just a few weeks ago, that that grant has been renewed for another 2 years. And so we're real happy about that. We serve hundreds of families a year with that grant. We have also our vocational skills assessment and treatment program that serves individuals with any developmental disability. Usually, most of them are between the ages of 14 and up. And we do this in partnership with the Texas Workforce Commission. Our Connecting to College program is a program that serves college students with autism who enroll at our university. So we provide support and primarily also not only provide support directly to the student, but make sure that we connect them to the other resources on campus that are available to any student, such as academic coaching and the disabilities office and counseling and career services, because we find that one of the biggest barriers is for these students to actually reach out and ask for these services. And so we arrange for them to do that. Now, coincidentally, and this is sort of foreshadowing when we talk about post-COVID, we also have been doing a lot of research and clinical work in the area of providing these services through telehealth. We have a telehealth project that we actually work with families all over the world. I have a master's level behavior analyst who created this project, and she has now worked with families in more than 22 countries. And finally, through a grant from the Houston Livestock and Rodeo Show, we have been every summer doing an intensive summer teacher training program where teachers from up to 6 different school districts come to our campus for 5 days. And we do this, we have 4 of them during the summer, and we provide really hands-on training on effective educational strategies for students with autism. And we did get that funding for this summer. We're still waiting to see what that's going to look like, though. Last year, we opened our Pearland Satellite Clinic, which is on the UHCL Pearland campus. And so we're able to provide some of our services to families at that campus because many of them were driving over an hour to get to the Clear Lake campus if they were coming from the west side. And so the Pearland campus is more centrally located. And finally, our off-campus program was a partnership with the Myers Center at Texas Children's Hospital to provide intervention and parent training services there. That will be ending in July. And unfortunately, and we've partnered with them probably for the last 3 or 4 years. Unfortunately, they do not have another funding source at this point to continue that program. We also have contracts with both Clear Creek ISD and Pasadena ISD to provide consultation services in classrooms to teachers. And finally, we have a Texas Higher Education Coordinating Board grant as well to provide that intensive summer training I described that the rodeo has been supporting. And we do this year round with different districts. And we're thrilled again to learn a few weeks ago that that has been renewed for another 2 years. So that's what we were doing before COVID. So we all went off on spring break, and then everything changed. Spring break was, I think, the second week in March for us. And so by the time we got back, all of our courses were going to be moved to online, and they were strongly encouraging people to not be providing clinical services in person and that kind of thing. And so since we already had been working in telehealth, I think it was a little bit of an easier switch for us than I think other providers, but we immediately, right after spring break, we hit the ground running with trainings and getting people up to speed about how to do telehealth services, because there is an empirical basis for it in my field. There's some research showing that it can be effective. And so what we have been doing, first of all, is providing remote support and training to caregivers through Zoom. This exact platform is the one that we're using. All 4 of these programs, ABASKIP, the Severe Behavior Disorders Research Clinic, the Verbal Behavior Clinic, and Connecting the Dots, all involve actually directly training caregivers, providing support. Some of it was that the same parent training services that we had been providing pre-COVID, we're just doing through Zoom. Some of it, we decided, maybe those particular goals are not the priority right now. So if one of the priorities of a parent was having a child not elope when they're in the community, obviously that's not relevant right now. What might be relevant is we have parents who are trying to work from home, and they also may have a very small child with. And so as you can imagine, that can be very challenging, very, very stressful. And so we basically are there to support them, find out what is going to be helpful to them, and to provide that support. So whether it be observing while they're working with their child, trying to get that schoolwork done and giving them suggestions about how to do that, or whether it be looking at their morning routine or helping them come up with a routine, these are the kinds of supports that we provide. in addition to working with caregivers, two of our programs, we are actually providing direct services to the individual because they are adults and are fairly high enough functioning that we can interact with them through Zoom to provide those services. So our vocational program, we're doing our vocational assessments and interventions, but we're doing that through telehealth, where we have the caregiver help in terms of just making sure there's materials there and setting things up, but then the caregiver leaves and we are interacting with that person as though we are a supervisor on the job. And for our Connecting to College program, for our college students, one of the biggest needs they had was all of a sudden all their courses were being transferred to online, and that can be very difficult for a typical student, but our students had many, many struggles with this. And so a lot of what we're doing, working with them and meeting with them through Zoom, is helping them navigate those changes and how to be successful through online formats. And finally, I mentioned our teacher trainings. We are also continuing to train professionals through Zoom. So for Clear Creek and Pasadena ISDs, we've been meeting with them, and they've been hooking us up and linking us with teachers who want some additional help. And so we've been having some Zoom meetings with those teachers, as well as our year-round ABA Academy. We have totally transferred that to telehealth. And it's kind of interesting because it is a hands-on type of training. And so what we're doing is role play through the video. It's a little challenging. We're learning as we go, but I've been sitting on some of those, and I just think they're going really well. I'm really excited by that. And so if we have to do that this summer, maybe for the June trainings, I think we'll be ready for that. Our goal, though, is to hopefully, if we can, do the live trainings, maybe in a modified version, maybe not have so many people together in the same room. But we're really hopeful to be able to continue that this summer. So I'm now very happy to open it up to questions.
Dorothea, it's Jack Bacon, and I would like to know whether or not the particular problem with autism is social engagement, and whether the decoupling and working through the video system may actually
I think we may have lost the connection there, but I believe I know what he was going to ask. So I'm sorry we lost you, but I believe that you are asking if with that social engagement, whether that would actually be advantageous to be switching to video conferencing or a problem. And I've seen both. So I have seen that some of our folks are much more comfortable interacting with us and others through a video format. And so Texana, which is a nonprofit ABA provider over in Rosenberg, they had some social skills groups that they were doing before COVID. They transferred those to telehealth, to Zoom, and I've been assisting them with that. And they have actually noticed that the individuals are more engaged, even more attentive than they have. Conversely, we have had some of our Connecting to College folks who are very uncomfortable with the technology. We've even offered to do it where they don't have to show their video, and they've been more willing to do it in that regards, and it's just audio and not video. So we've really seen it go both ways.
Thank you. Do you believe that this might actually change your treatment methodology when everybody comes back, that you'll tailor it depending on their needs?
I'm so glad you asked that question. This has been a total game changer for my entire field. Very few people were doing telehealth prior to this, and there are many advantages. I mean, one thing is, parents can describe things that are going on at the home, and we can try to go out there and observe, but it's a little intrusive to be there and sometimes not easy to get there. So now anytime we want, we can just pop in and see what's going on and give them some tips. And so there's so many benefits to that. And I know for sure that this is going to change the way a lot of people do things, where there certainly will be incorporating more of this into their services. I don't think it can totally replace live, but it can certainly be very nice supplement.
I was wondering, how many professionals do you have in the department and what are their backgrounds?
Great question. So the professional staff that we have 6 master's level board certified behavior analysts working for us. So their background primarily is in developmental disabilities and autism. They're all also licensed by the state as well, and have a lot of experience working with caregivers and teachers and those who assist those with developmental disabilities.
Thank you.
And they work with our graduate students. So we have 30 graduate students as well.
Dorothea, this is Greg Smith. I was wondering if you're seeing a continuous uptick in developmental disabilities, or are we doing a better job of testing?
Well, that's an ongoing debate. And what's really interesting, though, is if you look at the statistics, and our best statistics come from the school system. So they have a really good handle on numbers. And if you track it across the last 20 years, what you see is a crossover between intellectual disabilities and autism. And now autism, there's a greater numbers of individuals diagnosed with autism than an intellectual disability. But there's still a big debate in our field about, is there a true increase in the prevalence, or is in terms of autism, or is it just better screening and identification? I think it's probably a little bit of both.
Okay.
I think there probably truly is an increase, and I don't know what accounts for that.
How are you diagnosed with autism? How is it done? And then how do you determine the degree of severity? And is it done at the school level? Is it done? How is that all taking place to be able to report a child? Is it done early on, or is it done later on, or how does that happen? Does autism start as a youth, or does it start later on in life? I'm not really familiar with how it starts and how you find out who is really, has autism.
All great questions. So autism is something that you're born with, and with good screening. We unfortunately still, though, many individuals are diagnosed later. And even in Texas, we lag a little bit in that early diagnosis. It's usually later in the elementary school years, and it is usually because the school notices something. And school districts do their own assessment and identification of students with autism. Outside of the school district, a family can go to a medical provider or a psychologist, or a developmental pediatrician can do that diagnosing, and it is based on direct observation of characteristics, behavioral characteristics, and interviewing of caregivers. And then it is based on the DSM, which is the Diagnostic and Statistical Manual that professionals use in terms of how to classify their severity. Did I get all those? Did I get all the questions?
I have one. This is Michael Hugler. Asperger's syndrome. I understand that Houston is the premier center for conducting research and actually providing relief in that area. Do you know much about that? I've spoken to several people that had moved here because their child had Asperger's, and some affected more profoundly than others. and they said that Houston has a Asperger's Center here. I'm not quite sure, which is a form of autism, and I didn't know if you knew much about that.
So Asperger's is a category or classification that used to be in the DSM. And with the last revision, it's probably been now 4 or 5 years, that was removed. And generally, those who were a little bit higher functioning generally would fall into the Asperger's classification. I'm not aware of an Asperger's Center, but what someone may be thinking about is at UT Health Science Center, Dr. Kate Loveland has a clinic for adults with autism. And there's very few of those. Very few people diagnose adults, and very few people have services for adults. And so and most of her clients are very high functioning. So it's possible that that's what someone was mentioning. You're muted.
Well, thank you very much. I had always wondered about that, and I do have a very close friend who is Asperger's, suffers with Asperger's. I do see the issues with that, and but I appreciate your comments on it.
But if there is an Asperger's Center that you find out that I'm not familiar with, I would love to hear, send that to me. That
I certainly will. Okay, thank you.
Daryl?
I've had several friends in recent years who have kids who have autism, and many of these friends are having kids later in life, and I'm just wondering, is there something with that?
Yeah, so there's been a number of studies looking at different factors that might increase the likelihood of having autism, and one of them is the age of the parents. I believe the age of the father. Don't quote me on that, but I believe there's some evidence that the father's age is more of a link than the mother's to autism, but certainly you're right, age is one of those. Mm-hmm.
Hey, Dorothea, earlier in this Zoom session, we had a prayer that talked about people who are soldiers of faith and love for the community and service, and I just wanted to let you know you sure have fit that well in our community. It seemed most appropriate that you recognize that of yourself.
Well, that is really sweet. Thank you. You've really made my day. But I work with a group of fantastic people who bend over backwards and go out of their way to help families in our community. So I will take that praise that you just gave, I will take to them and let them know. Any other questions?
Does anybody have any more questions? Okay, well, we really appreciate, Dorothea, you being here today. You were very inspiring and very delightful to listen to.